My name's Siobhan McGirl, and today I'm sitting down with Mr. Kyle Hodgetts, and we're going to discuss his remarkable journey with heart disease. Welcome, Kyle.
Thank you.
So, Kyle, you claim to cure heart disease.
Technically, we haven't cured heart disease. You stop using the treatment, it'll come back. We reverse heart disease. If you've got clogged arteries, we can unclog them.
And you've got proof of this?
Oh, definitely, yes.
So, Kyle, can you tell me a little bit about your personal history? So, you come from a very different background, not a medical background.
They threw me out of school in grade 10. I was very naughty.
Were you?
Yes. I'm self-taught electronics engineer, computer engineer.
Wow.
I can program in every computer language.
Everybody knows somebody who has had an experience with heart disease. Is this something that you've experienced yourself?
Approximately 6 years ago, I had several stents in my heart. I had stents inside stents. They were clogging.
Can I ask what age you were at the time?
I was 56.
How many stents did you end up getting?
I had a total of 5 stents.
Wow.
But as I said, some stents actually went inside other stents and they were starting to clog up and they couldn't put any more stents in.
Right.
At the age of 55, the angina was coming back, and they gave me an angiogram and they said, your stents are clogging again, but there's nothing we can do about it. You've reached the limit of our medical technology, and said I had basically 6 months to live if I was lucky.
So what did you do?
A couple of years earlier, when my wife had a cancer, I was doing some research trying to come up with any cure for cancer, as anyone does. But I came across a study that showed there was this compound that could actually remove cholesterol from your arteries. So what I did is I investigated it more.
Where was this study done?
Okay, there's 2 parts to it. Back in 2012, there's a disease called Niemann-Pick's disease. And what it is, it's the inability for your body's cells to get rid of cholesterol. And it's generally in children, and they don't live very long, unfortunately. Some doctors in the US gave these children intravenous injections of a compound called Cyclodextrin. And what it did is it travelled around the bloodstream, it got to the cells, and it plucked the cholesterol out of the cells. Right. Which is fascinating.
Yeah.
Then in 2016, at Bonn University in Germany, some German scientists thought, well, hang on, if we get some mice with high cholesterol plaque in their arteries and we inject this compound into them, will it clear their arteries? It did. Stunning, stunning. In 4 weeks, their arteries were cleared.
Wow.
All this science is up there on Google.
And so you came across this research.
Yes.
And you went, well, this sounds good.
Well, it made sense to me.
Yeah.
I'm not a complete idiot. I didn't run to the shop, buy some and jab it in my arm.
Yeah.
I spent about another 8 months researching the science behind cyclodextrin. It's been around for 100 years. We use it in food production. We use it in medicine for other things. It was totally safe. And I'm thinking, well, why aren't the scientists developing it? It's 2016. By the time I looked into it, it was 2018. Why aren't they jumping on this? And the research I found out was because cyclodextrins, they occur naturally in nature, they've been used for decades in huge amount of industries, you can't patent it.
Right.
And if you can't patent something, you can't make money out of it.
So what is it exactly? You say it occurs naturally. What is it?
It's a sugar.
Okay.
It's a sugary starch. When you eat it, it just tastes like sugar.
Okay.
We use it in food production to make low-fat milks. It's in your cosmetics. It's in a lot of medicines. But what makes it special, it's a ring-shaped sugar. Being a ring-shaped sugar, on the outside, it's attracted to water, so it can go in your bloodstream. On the inside, it's attracted to oils. So when it goes in your bloodstream, oils like cholesterol, triglycerides, they get sucked into this little donut hole, and in your urine, just goes straight through your body.
So it goes into your bloodstream.
If you infuse it or use an enema, if you eat it, the ring is broken and then it gets absorbed as a sugar. It's the ring shape that makes it unique. What it does, you've got cholesterol floating around in your bloodstream. It's all free floating around. It'll suck up a little bit of that, but when the cyclodextrin hits an artery wall and it's got some cholesterol in it, it plucks it out.
Wow.
This is done in like a millionth of a second. It's a bing, just plucks it out. So it doesn't metabolize in the body. People with diabetes, if they infuse or absorb cyclodextrin straight into the bloodstream, it doesn't affect them at all. But if they eat it, it's a sugar. I did all the research on animal studies, absorptions. They give animals massive overdoses to see what the results are, but all that science is there. So for the next 8 months, because once I discovered it, I was planning to use it on myself, but as I said, I'm not stupid. I did all the research. How much, what dosage do you take?
8 months down the track, so you've done your further research and you went, okay, this makes sense to me. I'm going to be the guinea pig and I'm going to try it on myself. Is that what happened?
That's it.
How do you do that?
I looked at this from a professional point of view. I went out and I got scans done. I had my liver scanned. I got angiograms done. I paid for all this out of my own pocket. I had all the blood tests, hearing tests. I then sat down with some doctors and showed them all the research, told them what I was going to do. First doctor almost threw me out, but he laughed, and he eventually went through the research and he said, you can't hurt yourself with it.
So there's no negatives to taking it?
No.
Not one?
No. As long as you use the right cyclodextrin. Use the wrong cyclodextrin, they look almost identical and you'll have kidney failure within weeks. So it's very important you use the right cyclodextrin.
How do you know which one's the right one?
That's the 8 months of science research, and when I did the first infusion, I did 2 cyclodextrins. One was good, the other one wasn't good. But I found out.
Can I ask why it wasn't so good?
It caused a spike in the liver enzymes after I did the treatment.
An immediate, like within a week?
That was within 24 hours.
Oh wow,
yeah.
That quickly.
I didn't have any physical adverse reaction. I was getting blood tests every day.
Right.
And the blood test came back and I went, oh, that's not good.
Yeah. So who was looking after the blood tests for you? You had a doctor that was working closely with you on this?
I don't have any doctors that will admit to it.
Okay.
Because what I did
had
was...
contacts.
Yeah, what I did was considered a bit crazy, but I knew what I was doing. I had daily blood tests. I spoke to doctors all the time. Yeah, so I'm not suicidal.
So you did that for how long?
4 weeks.
So you did a 4-week trial on yourself?
Yes.
With daily blood tests?
Let me tell you. Okay, first day, 3 grams. It's like a little teaspoon of cyclodextrin. I'd mix it in the saline bag. Terrified.
An injection, was it?
Oh yeah, the doctor would put a cannula in, set the whole thing up. My sister, God love her, she panicked. She was like, oh, she had a crash cart sitting out the door, just in case.
Just in case,
happened. After I did the trial, we did an angiogram and my plaque had reduced. My cholesterol, my liver, everything went back to normal. It was like a miracle. I showed the doctor and they go, wow, that's cool. Go do a trial. I'll see you in 5 years.
What do they mean, go and do a trial?
Cyclodextrin isn't TGA approved to reverse heart disease or treat heart disease in any way. So doctors won't touch it unless it's proven through the TGA.
Okay. So they said go and come back in 5 years?
Basically, yeah.
And what do you think about that?
Oh, no, I fully understand it.
Yeah.
here I am, some crazy guy, I've done an infusion, I've done the scans, but that's me, that's one person, that's my body. You can't go and give it to people just based on that.
Now, as we know, you're not from a medical background, but you do have a team of staff who are?
Oh yes. My lead professor, Professor Laurie Howes, is the head of cardiac research at one of Australia's largest hospitals. I've got cardiologists around the world. I hire scientists that write up all the science papers. I'm supported by a massive amount of medical scientific professors.
So you did your trial and you got some fantastic results. What happened then? Did you continue trialling? Did you continue with the product?
Okay, so I did the trial. My arteries, they weren't totally clear, but the plaque had reduced substantially. So I still had heart disease. So for the next 6 to 10 months, I did some more infusions on myself. Very difficult. You've got to go to a medical clinic. You've got to get a cannula put in. It hurts. So I did a lot of research. There had to be another way to get the cyclodextrin into your body. I looked into snorting it, putting it under your tongue, your skin patch. There's a huge body of evidence, scientific evidence, on the internet about cyclodextrin and absorption rates with animals. And it turns out through the rectum is the only other way to get it into the bloodstream without doing IV.
Right.
So I was looking into creating an enema product so that I could get it into my bloodstream. But meanwhile, I had a lot of friends and knew a lot of people with heart disease, and they'd seen the results and they wanted to try it themselves. And some of these were doctors. So we'd take them to the clinic, they'd get an IV, they'd have some treatments, and more people wanted it. People are starting to get better. So I decided that, let me just tell you, prior to that, I was hoping that after the treatment, I could show my results to a medical company and say, here, look, I've got a treatment for heart disease. Yeah. No one was interested. They can't make money out of it because you can't patent it. So what I thought is I have to push forward more and more on my own. So I developed an enema version that people could use. After about a year, I'm giving this treatment to all my friends. There's enemas, etc. And I'm not wealthy. I had no avenue to get this product into the pharmaceutical industry. No one was interested in it, and yet I could see that it was going to save lives. So I thought to myself, all right, this is what I'm going to do. I'm going to supply the enema tube for now, just to people who desperately need it, and I'm going to do some more trials on myself and hopefully convince the medical industry through new trials to take on this product. So I started manufacturing the enema tubes, giving it to people I knew, and then suddenly strangers were contacting me and I was supplying this product. I did a second trial on myself, a very big one. It was very intense. It was for 6 weeks. It was 16 grams per day for 6 weeks.
Wow.
Results were stunning. I then took those results, I spoke to professors, cardiologists, I spoke to pharmaceutical companies. It was going nowhere. No one cared. I cured heart disease, but pharmaceutical companies wouldn't take it on because they couldn't patent it, so they couldn't make any money. Doctors wouldn't do anything because the pharmaceutical companies wouldn't do the trials. People are dying of heart disease. I'm sort of stuck on this crusade I didn't want to be in the first place, and I'm pushing forward. 7 years later, I'm still pushing.
So you have a number of people in the US using your products you've been selling it for the last 4 years. Do their doctors support this?
The very first patients we sold to in the US were doctors.
Oh, right.
Yes. We didn't sell to individuals at all. We gave it to the doctors. a famous doctor of ours, Dr. Roberts. He started it on himself. After about 8 weeks, he put 150 of his patients on it.
Wow.
He did basically what I did. He did all the research. He realised it was harmless. He saw it was working on himself. He puts 150 patients on it. 6 months later, they're all getting better. It's remarkable.
So you've mentioned the TGA. How's your experience been, and what does TGA stand for?
TGA, the Australian equivalent of the FDA. It's the Therapeutics Goods Administrator.
Okay.
They monitor and regulate all the drugs in Australia.
Right.
Australia has a great reputation for good quality medications and well regulated. In 2020, I registered my product, Cavadex, with the TGA. I started selling the product all around the world. About 6 months later, I got an email from the TGA, very similar to the email I got from the FDA saying, you're making these claims, you need to substantiate them with your trials, etc.
And the claim was?
That we were reducing heart disease,
And
reversing.
on the box or something, is it?
No, on our website.
Okay.
And they said that we had to remove those claims or register those claims with the TGA.
Okay.
Professor Howes called the TGA and explained what our product was, and he's the head of cardiac research at the Gold Coast Hospital. He's a very high-ranking cardiologist, and he explained how our product worked and how he's seen the results and people are getting better. The TGA, because our product is an excipient, not an active ingredient, they didn't know where to put us in their normal drug regulations.
Right.
So they said to Professor Howes to deregister our product from the TGA because while it's registered, they were obliged to regulate it. But they didn't know how to regulate it, so they said, can you just deregister it? They knew it's harmless. Well, the TGA said to the professor, we're a sugar enema. Coffee isn't TGA regulated, but it's being used as a coffee enema. We're a sugar enema. We don't need to be regulated. So for 4 years, the TGA have totally left me alone. I manufacture in Australia. I export all around the world from Australia.
No worries.
No problems.
So why do you think the TGA are leaving you alone?
I think it's because they know our product is a cure for heart disease. Now, can you imagine the public backlash if the TGA was to try and shut down a product that cures heart disease, saves lives? They shut it down, and can you imagine a year later it's proven that product actually worked? Could you imagine the backlash the TGA would get? They know for a fact we're not harming anyone. They know it works. The science is there. We've published papers. They're in a difficult position. They just got to let us go.
This doesn't make sense. For someone like me listening to your journey and the results and all the thousands of people with the results, that this isn't supported.
It's crazy. It's totally crazy. Wait till I tell you about the FDA.
Well, please tell me.
All right, we've been selling this product worldwide for 4 years. Thousands and thousands of patients. Everyone's getting better. Not a single side effect reported. Beautiful. It's shipping into the US for 4 years. Approximately 2 years ago, the US FDA sent me an email saying you're making claims on your box that you reverse heart disease. They said, can you please take those claims off or else we're going to destroy your product crossing the border. Fine, I took those claims off the box. Today we still don't have those claims and they were fine. All our product goes through.
Yeah.
But now a lot of doctors are talking to the FDA saying this is a miracle treatment. People are going off their statins, people are going off their blood pressure medication. Approximately 6 months ago, the FDA started destroying our product as it crosses the border. Now, it's not because they think I'm making money out of it, because a lot of our product that goes to the US, we ship for free. We actually give away a lot of product to the war vets, etc. it's being destroyed at the border. Let me show you how this does not make sense. Every week in the USA, tens of thousands of kilos of cyclodextrin, the exact same molecule that I use in this treatment, crosses the border into the USA. Now, out of all that cyclodextrin, every week that goes into the USA, this much goes to the food industry. You consume it. They use it to make low-fat milk. This much goes to the cosmetic industry for your cosmetics. This much goes into the medical industry, where over 20 FDA-approved drugs use this cyclodextrin in their drugs. This much goes to Johnson & Johnson's COVID vaccine. This is the same molecule, but this much where someone is bringing it in to save their own life from heart disease, it gets burnt in a furnace. They destroy it at the border. The exact same molecule. But if you're using it to cure your own heart disease, they'll destroy it. How does that make sense?
It doesn't, because we can eat it as well and drink it in our low-fat milk and put it on our skin.
If you and I are sitting in California right now and we order some grapes from Italy, delicious grapes, we import them, we eat them, fine. But if you import grapes to eat and I import the same grapes, but I'm going to stick them in my bum because I think it's going to cure heart disease, those grapes will be treated like a toxic ingredient and be destroyed. How does that make sense?
So what's happened in the last 4 months?
What I think's happened is we've been shipping for 4 years. The evidence is building up so strong that we are actually reversing heart disease.
Yes.
We've got doctors talking about it. It's all over the internet. We've got customers putting up their testimonials. We've got calcium scores going down. It's impossible for a calcium score to go down. Once you get calcium in your arteries, it just keeps building. We're reversing it.
What about your customers who are relying on your product?
Look, I don't know what's going on, but it just doesn't make sense. We've got a treatment, we're saving lives, doctors are using it, they're giving it to their patients. We're seeing incredible results. Why is the FDA, after 4 years, suddenly destroying our product at the border? And it can't be that they think we're taking financial advantage of people, because most of our product that goes to the US, we give free. We ship
to veterans.
We ship to veterans, we ship to people who can't afford it. We get contacted all the time from people that can't afford our product. We give them massive discounts, we'll just ship it for free.
So what are your steps from here then? How can you rectify the situation?
Well, at the moment, we're lobbying high-profile politicians in the US. You know, we've just had the US elections, and we're going to see if we can get some action there that we can just get our product through. We don't need special treatment. Just let our product through. It's not hurting anyone, it's saving lives. Just let it go through, it's fine.
Personal question I have. Supplement companies, people that sell things like collagen and liver capsules and things like that, how do they do that and you can't?
Oh, their products don't work. They don't threaten the pharmaceutical industry.
So how do people know and learn about the product?
We've got a website where we publish all our science. All our science is on our website. So people can make their own informed decision on our product. We have a warning down the bottom of our website saying that we are not FDA approved to treat heart disease, which is true. We're not FDA approved to treat heart disease, but we do reverse heart disease. So we make that claim. The FDA just hasn't verified it yet. But I believe people should have the choice. Present them information. This product is totally harmless. Cyclodextrin is FDA approved. Totally harmless. People should be able to make a choice from, just give them the information. People aren't stupid. If they want to try it, they should be able to try it. And a very important thing is heart disease is terminal. If you're terminal and you're going to die, you've got a right to save your own life.
Absolutely.
You've got a right to look everywhere. And if you find something that you believe will help you, you should have the right to try it. I understand the FDA, if we were harming people in any way, I fully support the FDA. My product should be cautioned out like crazy. We're not. It's harmless. It's a sugar enema.
It's all natural.
It's all natural, and it is saving lives. We've got people with calcium scores going down. That's unheard of. We've got hundreds of people with calcium scores going down. It works. People should be able to make their own choice, present the information. The FDA want me to stop presenting the information. They want me to stop saying that we're reversing heart disease. They want me to stop showing all the data. They want me to stop showing the videos of doctors saying that their patients are getting better. It's free speech. Look at me, for example. Okay, I don't expect people to do what I did. Go out and grab a compound and start injecting, etc. But I've done that. I've done all the hard, dangerous stuff. This stuff works. I was supposed to be dead over 6 years ago. My wife passed away. I was supposed to be dead. But now, it was my son's 3-year birthday yesterday. I have a new wife. I have a new family. I've got a life that I should never have had. I need other people to have this opportunity to live longer. Now, people with heart disease, you've got grandmothers, grandfathers, you've got brothers and sisters, fathers, mothers. If you can extend their life by 5 years, can you imagine a grandmother spending an extra 5 years with their grandchildren? You know, a child having a father for an extra 5 years. People in work with such skills. Can you imagine their skills going on for another 5 years? Imagine Einstein lived another 5 years. This is too important. This is too important to give up on, and I'm not going to give up on it.
The thing that sticks with me with this product is because it is natural and it doesn't have any side effects, you've got nothing to lose by taking it. There's no risk.
That's right. That's right. We're not harming anyone. We can't harm anyone. We're not ripping people off because we give most of it away for free. There's no downside to the product. The TGA in Australia, I think, have done the right thing. They've let us continue on. I've got a moral responsibility that I have an opportunity to save lives. I morally can't walk away from that. I've got a moral responsibility, and some could argue a legal responsibility to push forward with this product. People are dying, and I've got a way to save their lives. I can't back down on it.
Thank you so much for joining us, Imogen. What is your role within the business?
I handle the marketing customer relations.
I really noticed your passion. And you showed me on the Facebook page, you were saying, and then there's this gentleman who's 83 years of age and now he can roller skate or rollerblade. Can you tell us a little bit more about some of the success stories?
Yeah, no, of course. So I think with anyone who approaches the product, finds out about it, you know, someone else is speaking about the product, it doesn't sound true. And it's so unbelievable the impact that it has had on individuals and Kyle himself. So when I came on board, I had that same reaction. This doesn't sound real. What is this product all about? How does it work? So without Kyle knowing, I actually took some papers and showed my family doctor. And they went through it and they just could not believe that this existed. For starters, this data was out there, and it has proven to change someone's life. So, you know, that was a really big thing for me, of kind of, that was the tick of approval, because a lot of people do need medical practitioners to give it that tick of approval. So with that, you know, and then I witness people every single day who have had their lives changed in person and also online. So, you know, a lot of Americans in particular, they're very, very passionate about telling their story, and that's just their personality. And so every day I get to read these beautiful long messages of people who are now being able to chase their grandkids around the yard, and they weren't before. And they tried everything.
And with regards to actual data, I know that you can't share people's personal data at the moment, but you did mention quite a significant decrease in people's calcium scores.
There's a few online that we do have public that people have felt comfortable enough to reveal their data as well. So we had one woman who, she had done her scores, and I think she had a score of about 704, and then a year later she got retested, and the only thing she did differently was she tried a 3-month protocol of Cavadex, and she went down to a 234.
Oh, wow.
Which, if anyone does any research, that doesn't exist. Calcium scores do not go down, and anyone who finds out they've got heart disease, discover they've got heart disease, they can find that out for themselves. The product does not exist like that.
And the gentleman that you said, he's...
Oh, yes. He is a patient of our cardiologist, Dr. Roberts. So he's been using Cavadex, I believe, for about a year and a half. He's 83 years old. He was so invested in his journey with heart disease that he did diary entries every single day of how he felt. You know, he was reading stories of him, you know, going out back and chopping up wood. And he's 83 years old. Like, you know, that's just unheard of again. So, and, you know, he loves to write stories. I love all of our customers' stories. You know, that's the best part of any marketing role, really, is kind of the user's impact. So, you know, hearing his story of, you know, he's rollerblading and he falls down and people are really worried because he's 83 and he gets back up and he goes, that's because of Cavadex. I love it. Like what we get from people, it's just amazing.
Is there anyone in your personal life that takes the product?
Yeah, I've got family friends on the product, and also friends and family who are, you know, in that horrible situation with heart disease, and they're on the product, and, you know, it's convincing them to do one thing where I'm working in a role and, you know, I'm working with these people, and once again, you know, it sounds too good to be true. Yeah. And then actually having them, okay, you know what, nothing's worked for me. I'm going to try it because what have I got to lose? And then, you know, I just actually got a message last night from one of the family friends, and they go, can I get more? Because I'm going out exercising, I'm not on the couch, and, you know, this particular person, he battles with diabetes, he's got a plethora of pills that he has to take, and just so he feels unfit because his body is aging before him. And then now, after being on Cavadex for, you know, I think he's been on Cavadex now for 2 months, he's exercising again, and, you know, he's doing all these amazing things that he couldn't do before. And so that's just, you know, the cherry on top that I work for a company that can do that as well.
How is it working with Kyle?
He's definitely inspiring. It baffles me that, you know, this overwhelm of a beast that he's trying to overcome. And, you know, we've spoken to some pretty significant high profile people, and the corporate kind of structure that is just naturally in place, it's pretty intense. You know, we've got the science, and they're all, you know, wide-eyed and, wow, this is incredible. And then we'll come off a meeting and they'll be messaging us for product, and I'll be shipping it over because they want to give it to their loved ones. Yeah. But then there's so much more red tape. And it's like, how is that fair? You know, when this is so impactful and so real, how is that fair that, you know, these people in suits have to take months, years just for it to be out there? I know for a fact Kyle wakes up every day knowing this is his mission. And I think that speaks volumes in the people we speak to, those high profile characters that can significantly make a difference. And, you know, right down to the customers that we deal with every day. I think the impact that Kyle already has on, you know, the world is significant, and it's going to be in 10 years as well.
I would imagine there would be people in that position where this would be so overwhelming and too hard. But not Kyle?
No, definitely not Kyle. He has put the correct people in place around him that are going to you know, like Dr. Roberts, for example, that renowned cardiologist in Ohio, and, you know, he needs to push, and he needs to get it out there. There's no other way around it. And I think, you know, Kyle, it would not exist if he quitted tomorrow. He can't quit.